Her blood sugar is currently 8.7, and I'm able to follow what her blood sugar is on my phone.
Susan Simpson monitors her 13-year-old's blood sugar in real time to make sure she's safe while at school. But last year, that reassurance turned to panic when she was notified her daughter was in danger.
I was in a meeting at work and I got an alert that her blood sugar had dropped and was low. And I was frantically phoning you.
Ruby Johnston was on a tree planting field trip and had no access to a sugary snack that could help her.
It was a pretty scary situation because nobody told me we were going on a field trip.
They packed up the school bus as quickly as they could and drove to a gas station and got her juice. She was fine, but that triggered a sequence of events with the school that, in that situation, the outcome could have been way worse.
It is an incident Simpson says should never have happened had there been a formal protocol for the 8,000 students in Ontario with type 1 diabetes.
We discovered that because there's no formal policies, we are the voice of all of it, and the kids sometimes just aren't safe.
Parents are urging the Ford government to implement mandatory standards of care for all students with diabetes across Ontario, similar to BC and Nova Scotia, where province-wide mandates require care to be delivered by educational assistants.
It varies wildly between school to school and even principal to principal, teacher to teacher, class to class, and it's not even guaranteed that your child will be safe.
Facing the tough reality inside schools, Alana Diening has been advocating for her 7-year-old son for years.
He can't dose his insulin himself, he can't monitor his blood glucose, and he can't administer his own glucagon. So those are big priorities to keep a child safe at school.
Currently in Ontario, she tells us diabetes care is supposed to be handled by nurses, but they are in short supply at schools, so too are EAs.
If care is designated to EAs without increasing staffing, we'll likely be in the exact same place that we are with nurses now, which is you cannot designate care to staff that doesn't exist.
The Ford government is currently reviewing school guidelines around prevalent medical illnesses, including diabetes, asthma, anaphylaxis, and epilepsy.
But I want to make sure that they know how to manage type 1 diabetes, and I want to make sure that they're there for me when I need help in those situations.
The Education Minister's office wasn't available for comment. For City News, I'm Tina Yazdani.